Great. Well, I know we still have folks joining, so we'll give everyone a minute to get settled. I'm Doreen Marshall, and I am the Vice President of Mission Engagement at the American Foundation for Suicide Prevention. Just getting ready to share my screen here. Oh boy, not the clicks. Here we go. I appreciate that many of you are joining us today. I see people still logging in, so we'll give a few minutes for folks to join. Today's webinar focused on the Model School District Policy for Suicide Prevention, and I'll say a few words of introduction shortly. Certainly want to thank the Department of Education in South Dakota for hosting us and inviting us to do this webinar. Throughout the webinar, there will be an ability to ask questions, and we will take some questions at the end of the webinar. You can type your questions in the Q&A portion at the bottom or on the toolbar on your screen as we go, and we'll take some at the end of the webinar. Okay. I think we looks like we have a couple more folks joining. Again, I'm Doreen Marshall. I am a psychologist that works at the American Foundation for Suicide Prevention and was one of the folks that worked on our model school district policy with our partners. I'm also joined today by Taylor Wolf from our public policy office at AFSP and Samantha Christofferson, who's our Dakota area director and oversees both North and South Dakota. Okay, so I think with that, the other thing, just to say a little bit about AFSP, if you're not familiar with our organization, we are a private nonprofit organization where our mission very simply is to prevent suicide and to support those impacted by suicide. So we do that through a number of strategies. A big one of our strategies is our education work, hosting programs like these, and also education programs on suicide prevention, mental health, that are delivered through our chapter network. We are a national organization. We have chapters in all 50 states. And we also engage in advocacy, and Taylor is from our public policy office in DC. And we work both at the state and national level on public policy initiatives related to suicide prevention and mental health. And we're also an organization that delivers programs to those impacted by suicide death. So we support suicide loss survivors, as well as fund research. We are the largest private funder of research of suicide prevention research in the United States. So with that, I'm just going to kind of give a bit of an overview about what we're going to talk about today. We're going to talk a little bit about the requirements related to K-12 suicide prevention in South Dakota. We'll speak about our model school district policy resource, and then also talk about some resources related to developing a policy. And Sam will also give some information about our local work in the South Dakota chapter. And again, I'm Doreen Marshall, joined by Taylor Wolf, who's the manager of state policy at AFSP, and Sam Christofferson, who's the Dakota's area director. Okay, with that, I'm going to turn it over to Taylor so she can talk a little bit about the K-12 requirements in South Dakota.
Thank you, Doreen. So as Doreen said, I am manager of state policy. So I work out of our DC office, but I work very closely with our chapters in setting our policy priorities. I work with them to do advocacy days at the state capitals. Unfortunately, South Dakota's was canceled because of weather this year, but we might be doing them virtual this year, so that won't be an issue. So I work very closely with Sam and North and South Dakota on advocating for legislation. So over the last decade, AFSP's legislative efforts in schools have focused on two main big areas, training for school personnel, and then the adoption of school suicide prevention, intervention, and postvention policies, which is what we're going to focus on today. But just to give you a little background, in that first area of training, we have made significant progress to date. So in 2012, a model bill was created for AFSP field advocate volunteers, chapter volunteers, and members of the general public who wanted to propose legislation to their own state lawmakers. And we've had a great deal of success. Since 2011, the number of states that require suicide prevention training for school personnel has more than tripled. And Doreen, can you go to the next slide?
Sure.
To give a visual of the progress that's been made, I wanted to just show you this map. So like I said, it's 33 states plus DC require training. 14 of those states who require it do require it annually. And then an additional 15 states encourage the training. So at this point, the only 2 states without any training laws of any kind are only New Mexico and Vermont. So it's been pretty successful. And South Dakota is included in that. You can see it's color-coded green because training is required, it just isn't required annually. And then the next slide just kind of lays out the law. So it requires, it was adopted in 2016. It requires a minimum of 1 hour of training for initial certification and renewal of certification as a teacher, administrator, or other education professional. And then, so the second area, like I said, and what we're going to focus on today, a focus for our advocacy has been encouraging schools or school districts to adopt a policy on prevention, intervention, and postvention. We know prevention efforts cannot be done in isolation. So with these intervention and postvention policies in place to ensure students at risk receive appropriate services, and then also that suicides in the school community are addressed safely, preventive approaches such as the staff training that's done in South Dakota can be even more likely to prevent suicide. So that's why it's imperative that schools adopt comprehensive policies and procedures to support personnel and provide them with a clear roadmap that's accessible year-round, and it goes over how to prevent, intervene, and respond to student suicidal behavior. And that's why that in 2015, our model legislation also includes language that mandates school policy, though not quite as many states require that. And then in 2014 is when we first released the model school district policy, and that Doreen's going to go into detail about. And we did that with the American School Counselor Association, the National Association of School Psychologists, and the Trevor Project. And then the four organizations revised and re-released that model policy in 2019. So what we're going to go over today, you can use this policy either to kind of just as an example to adapt it, or we also have it available as a template to just kind of adapt to your needs and make it a little bit easier. So with that, I'm going to turn it over to Doreen to talk in more detail about what's actually in that policy.
Thanks, Taylor. So like Taylor said, the model school policy document is a document that we've worked on with partners at the National Association of School Psychologists, the American School Counselor Association, and the Trevor Project. And the original document had been developed, but then last year in 2019, we published a revised version that had more information in it related to considerations for implementation, because all of the organizations were hearing from the public and from schools that really more was needed to help think about implementation of the policies. So the policy document is available as a download. It's available on all the partner websites, but you can find it downloadable as a PDF, and on the right side of your screen is actually the cover of the document. We also have some limited print copies available in our store, but the model school policy document can be downloaded. It's a free document at that link. And like Taylor said, it can be used as a template document to write a district model school policy for suicide prevention. So it kind of gives you the template, and then schools, can adapt it to their individual needs. It also, I think, highlights the kind of best practices and really what's required in many school policies to meet the legislative requirements. So it has some actionable steps in it. There's sections on how to involve parents, sample language for student handbooks, and then also guidance for addressing in-school suicide attempts. So we'll be talking about some of the sections more completely in a moment. So the other thing I should add, Taylor mentioned that the document itself is available as a template. So in addition to being available as a PDF, we also have the policy wording in a Word document that schools can request from us if they want to actually kind of cut and paste sections of the policy into their policy document. But what this document is that it basically provides policy language for a suicide prevention district policy. It has a section on commentary and a section on resources. So there's the policy language section, which is the section that districts often use the actual language for, and that's totally fine. And then we also developed with the partners a commentary and resource section to also help schools as they're learning more and considering how to implement it. The document is applicable to education levels K through 12, so across the K through 12 spectrum in terms of developing district policy, knowing that some of the things you implement as student education, for example, will differ in terms of age appropriateness, but the policy itself is applicable to all K through 12 education levels. And it covers this across a number of different areas that schools are connected to. So things that occur in school, on school property, at school-sponsored functions, and really is looking at the entire school community. So part of what the document outlines, so how to respond to a suicide death, there's a section on postvention, and there's more specific information related to how memorials, for example, might take place, etc. I should mention that there's a parallel document on after a suicide called After a Suicide Toolkit that we also developed with partners. And that document is also a free download that can be used in kind of tandem with the model school district policy because it addresses in depth what schools can do when there's been a suicide death. So model school policy is going to talk about postvention, but we have a much more comprehensive document that focuses on responding to a suicide death in a school. And basically, the model district policy document is really about addressing the school's response to high-risk behaviors or to students at risk. So as we dig into more of the content here, you'll see that that's really one of the goals of the document, is to help schools appropriately respond when students are at risk for suicide. I did see a question come in about this is being recorded and the recording will be made available. We can also make a PDF of the slide deck available to those attending. Okay, so one of the key areas of the model school policy is talking about key roles and role definition within a policy document. So the model policy calls for the appointment of a district level suicide prevention coordinator who's appointed by a superintendent or designee, who along with the school building principal is responsible for coordination and implementation. So there's kind of two designees here. There's a district level coordinator, but then the actual school contact starts with the building principal being responsible for the coordination of the policy and implementation. And then there's also a designated school-based coordinator, designated often by the school principal, as the school point of contact for mental health and for things related to the policy, and we'll talk about that in a second. So the principal, the building principal, is really responsible for the coordination of things like making sure all faculty know about the policy, that know how to implement it, but then for the actual mental health contact, there's often a school-based coordinator who's the point person for that. And then the idea is that at-risk students are to be reported to the school suicide prevention coordinator. So whether it's a teacher or other staff member that realize someone is at risk for suicide, that information needs to be reported to the school suicide prevention coordinator. And again, there's more information as you look at the document itself on these roles and how they're written into the policy document itself. The document also talks about education, and as Taylor mentioned, South Dakota does have a requirement for education and recommends annual professional development on suicide risk factors, warning signs, response procedures, so staff are aware of what to do should they become aware of a student at risk for suicide. It also addresses postvention and resources. And there's a recommendation that the education also include additional information regarding groups of students at risk that is relevant for your school district. So, for example, having information specific to LGBTQ students, homeless students, students who are in foster care, students with medical conditions. And this is where you can include more information in the professional development that's focused on students at risk that's relevant for your environment. So you may know that your school district has multiple groups of students that cross these domains, and you can actually include more information in your annual professional development related to these groups. And then some states also have a requirement in terms of student education. You know, as Taylor mentioned, the requirements for South Dakota do not have that specifically, but the idea is that if you are going to integrate suicide prevention education into your curriculum, that it's done in a way that's developmentally appropriate. Often this is integrated into health classes or other curriculum where there's kind of a natural fit around social emotional learning, particularly for younger students. We focus much more on social emotional learning, whereas for older students, such as high school students, AFSP has our More Than Sad program, but there are programs that are focused much more on educating about mental health. But the broader spectrum on this is that it should also help students across K through 12 understand who to go to if they're concerned about a friend, and kind of who are the adults to reach out to help for within the school environment. The policy document talks about this in depth, but when a student's determined to be at risk, there's a couple of things that we highlight as practices here in the policy document. One is that, you know, once it's determined that a student is at risk, so let's say an educator gets information, or a student makes a disclosure, or turns in an assignment where there's some concern about suicide risk. As much as possible, there should be continuous supervision of the student by school staff until an assessment occurs and is complete. So this isn't a time when you want to leave the student alone, but that you want to make arrangements within your policy for there to be continuous supervision. Both the school principal and school suicide prevention coordinator are notified as soon as possible. And often they're involved in the response, particularly the school suicide prevention coordinator. But there's often districts decide that the district coordinator also needs to be needs to know that a student at risk is being assessed. There will be parent and guardian notification, and that needs to occur in a timely manner, and that urgent referrals are also provided. And that as you're thinking about parent notification, there is much more information in the document itself about parent notification. So that's something that we see as needing to happen as soon as possible. Finally, the considerations to engage law enforcement or emergency, really we want schools to think about when there might be circumstances when law enforcement or emergency services need to be engaged. Certainly this would be the case, for example, if there was a threat to the school environment, or if a suicide attempt, for example, is made on the school, in the school building or on the school campus, that these might be instances where you're enacting law enforcement or emergency personnel, both for the safety of the student, but also for the safety of the school environment. Some other key takeaways from the policy document is that it's expected that assessment and referral would occur in a timely manner, and that's within the same school day, as well as parent notification occurring on the same school day or as soon as possible once a student at risk is identified. So the document talks more about parental notification, but just to say that there's a timeliness to both making sure assessment and referral occur, but also that parents are notified, the parent or guardians are notified as soon as possible. The document also talks about lethal means counseling provided to parents. We're going to talk about that separately in a moment, but also that we focus on making plans for re-entry procedure for students following a mental health crisis or mental health hospitalization. So let's talk a little bit about parental notification. Obviously, this is going to follow your state and local codes and guidance around parental notification. But the model document itself talks about parents being notified of any level identified risk the same day or as soon as possible by the principal, a designee, or school mental health staff. So, the takeaway here is that when a student at risk has come to your attention as being at risk, that parents are notified as soon as possible. And then based on the initial assessment and following the parental notification, next steps are determined based on perceived student needs, so that there may be some differences about what happens next, but that they should always follow this kind of idea of parent notification, initial assessment, and then a documented plan of next steps. And we do recommend that you seek parental permission, such as a release of information to communicate with mental health providers. As I mentioned, some of these next steps may differ depending on the individual circumstances of the student. So for example, students that are already in mental health care, this may be more about involving the existing mental health provider than making a separate referral. But again, you want to make sure that the next steps are clearly documented and that whenever possible, that you are able to have releases of information to communicate with mental health providers. And you would seek parental permission for that. Let's talk a little bit about lethal means counseling, because this may be less familiar to some of you on the call. The idea of lethal means counseling is really about having a discussion with parents about the home environment and safety in the home environment. And this is often done by the school-based mental health professional. And there's some things we focus on more specifically around lethal means counseling. Since we know that firearms are the most lethal form of suicide, we do, in the document recommend that an inquiry if firearms are kept in the home or accessible to a student is made when talking to the parents. So you could ask that if a firearm is available in the home for recreation or for sport, or for personal protection, to ask if a firearm is kept in the home, and then if so, is that firearm accessible to the student? And we recommend that firearms, whenever possible, when there is a student at risk, the safest approach is offsite storage. So that may involve problem solving with a parent about offsite storage. But if offsite storage is not an option, then storing the firearm locked and unloaded, inaccessible to the student. So when I talk to parents about this, what I often ask them is, where's the firearm kept? Is it kept in a locked safe or with a locking device? And then I problem solve with them, if off-site storage is not an option, about what they might be able to do to make sure that firearm is extra secure. So it could be, if it's a key lock, making sure that the keys are stored on the parent's person and not left accessible to the student or left in the home in a place that the student can access it. I may also talk to them about storing ammunition separate from a firearm, making sure that the firearm is stored locked and unloaded. Disassembled would be another thing. But it's really about problem solving so that their child doesn't have easy access to a firearm. And that's going to vary to some degree, but you're really working with the parent to make the environment safe. The other thing I'll add is that, what we know about suicide is that if the method is not accessible, people are not likely to switch methods, that most people in the moment don't have that kind of cognitive flexibility to enact another plan. So this is why we pay a lot of attention to making sure the home is as safe as possible. And that's not only about firearms, it's also about medications being stored locked and away from the student. So it may be having medication stored in a lockbox. It could also be if a student is taking medication, filling out a kind of a pill box for students, like a weekly pill box, and then keeping the rest of the medication stored. And that also includes over-the-counter medication, as we know that many of them, taken in quantity, can also be lethal. So you're really problem solving, thinking through with the parents, what might we need to do to help help the environment be safe. And we focus on firearms, medications, but certainly if there's other things that you learn about that the student is thinking about, we want to work with the parents to help them make the home as safe as possible. The model school policy document itself also talks about re-entry procedures, and what that means is students returning to school after a mental health hospitalization or a mental health crisis. And the document recommends that the school-employed mental health professional, principal, or designee meet with the student's parent or guardian. Occasionally, it will be appropriate to also have the student, and I think that's kind of the judgment call to make based on the student's age and the circumstances. But if it's appropriate to include the student, that makes sense, to discuss and coordinate reentry. So some of this is going to be about the school making sure that the student has gotten some treatment that is connected to treatment, but also thinking about things about where accommodations may be needed. This should be documented. So really this is about the school mental health professional and the school staff thinking with the parent about what accommodations are needed to help ease the transition back. It might have to do with getting missed work or makeup assignments from teachers, but really kind of thinking about how a student might return to school. And a way to think about this is how you might have a student return if there had been any medical emergency. So thinking about how to ease that transition and having a process discussed with the parent, but also documenting that process. As the student transitions back, there should be someone who is having regular check-ins with the student and student parents. This is often the school mental health professional, but it can be another designee. But the idea is that you're checking in to make sure the transition is going well, making sure that the student is getting what they need. And, mental health being covered by the American Disabilities Act, we really are thinking about this like any medical emergency. So as much as possible, working with the student and parents and checking in often to make sure that there's a transition back that's smooth as much as possible. The student's teachers can be informed that the student is returning after a medical absence, but it really is on a need-to-know basis. Any more detail about that? So, again, you're limiting the amount of information that is shared about the specifics, but more informing teachers that the student is returning based on a medical absence and keeping detailed information, particularly about subsequent conversations with mental health providers and the parents, more on a need-to-know basis. Okay, so the other thing I should talk about is the commentary sections of the model school policy document. And you'll see this when you take a look at the document, really go into more depth on some of these areas. And while not part of the actual template, we did want to expand on some things in the commentary sections. So we did expand on the section related to parental involvement. You'll see that when you look at the document. Also the importance of school-based mental health supports and really schools kind of assessing who their school-based mental health supports and what level of capacity they have as they write the policy document. Having a task force as a best practice, so this is an across-district task force. That's really a way that we can learn from one another by kind of and look at the policy and make changes as needed. Having specific referral or considerations for LGBTQ youth, considerations that may also overlap, say that 10 times quick, may also overlap with bullying policies, other crisis policies, but you want to look at kind of making sure you have appropriate referrals related specifically to LGBTQ youth, but that these referrals also make sense with your bullying policies or other policies you may have. There is a section on messaging and suicide contagion in the document itself, and we do go into this in much more detail in the After Suicide Toolkit, where we have templates, letters to students and parents following a suicide death in terms of communication. And always, as Taylor mentioned earlier, you want to make sure that what you're doing is consistent with state laws, and as these change, adapting your policy document to reflect the latest in state laws that are relevant. Okay, so a couple things around implementation, the requirements for training in South Dakota, and this is important to think about how you're going to implement and make those requirements for training part of your model school policy. You certainly want to think about the considerations for high-risk populations that your district has more students. So for example, if you have more students that are LGBTQ students, that LGBT students are a higher risk population. Also if you have more students that have disabilities, homeless students, that these higher risk populations, students that have experienced trauma, you want to make sure that you're considering that in the implementation of your policy. We talked earlier about the designation of a school suicide prevention coordinator, but also that you want to make sure the implementation, that roles and responsibilities of your team members are clear. That, in other words, people know when there's a handoff and who's doing what, who's informing parents or who's involved in parent notification, who's involved in student contact or supporting the student, making sure the student is not alone, those different roles and responsibilities to make sure they're clearly defined. That it's clear who is conducting the risk assessment and what that process is, how it will be documented and communicated, and making sure your referral lists are continually updated. Some other things your policy should include is this consideration of in-school and out-of-school suicide attempts. So you'll see in the document itself, we address both, but the idea is that an in-school suicide attempt might have some different steps to follow than an out-of-school suicide attempt, particularly around enacting emergency support, but also there may be some differences around how parents might be notified. So for example, an out-of-school attempt you may learn about from a parent. And so, thinking about how that will work with reentry and all of that, there's deeper consideration in the policy document itself, and particularly in the commentary sections to look at on this. We talked about how to inform parents. I do want to point you to looking up also the After Suicide Toolkit for Schools, which goes into great depth on postvention, but to know that your model school policy or district policy for suicide prevention should also have postvention components in it. And again, there's the link to find the complete policy document. Okay. It's really important. This is how districts get started to learn about how to develop a school district policy, but also for districts that have policies to be able to kind of measure it against this model document and look at areas where there's gaps in school district policy. But the goal is we really want as many states as possible to have a coordinated effort around adopting school district policies, and that this document, the model school district policy, is really a template for you to do that. Okay, I'm going to turn it back to Taylor to talk a little bit about AFSP resources, and then I know Sam also wants to talk a bit about the chapter's work.
Thanks, Doreen. So as Doreen mentioned, for the model school district policy, that link is here. I do want to let everyone know one thing I meant to add to this slide and forgot is the After Suicide Toolkit, but we will be sending around a follow-up email. So we will include those links for you. And then I know in some of the survey responses, people had asked about statistics. So we'll also be including the South Dakota fact sheet, which kind of goes over the suicide rates in South Dakota, and then on the back it has what state programs and policies currently exist. So I did just want to point that out, that we will be sending a follow-up email with that information. But then otherwise, if you are interested in more of like the policy advocacy side, if you go to afsp.org/priorities, you can also download our K through 12 issue brief, which will go over why this issue is so important, why the training with the policy is so important, and then also which states have which laws, if you're interested in learning more about that. But then otherwise, AFSP does offer several resources for schools to implement existing laws or offset the cost of legislation like required training. So to learn more about trainings AFSP chapters can provide, which Sam will also talk a little more about, this includes More Than SAD, which has programs for teachers, parents, and students, as well as an online teacher training Signs Matter program. So you can visit afsp.org/education. To connect with your chapter, if you go to afsp.org/South Dakota, on the local chapters page, you'll find a sign up form to volunteer. You'll find the contact info for Sam, the area director. If you do sign up to volunteer, you'll also receive emails about other trainings like this and other things AFSP is doing. So it might just be good for that reason as well. And then Sam can provide the guidance on bringing these trainings to your school. And then finally, because of everything we're dealing with now, especially when it comes to going back to school, I did want to share that we have COVID-related concerns around mental health and other current issues at afsp.org/COVID-19. So with that, I am now going to turn it over to Sam to talk in more detail about the work she does at the South Dakota chapter and kind of how she can guide you through some of this.
Thank you so much for joining us today. I know all of you are in different places in South Dakota. So thank you so much for joining us virtually. Just a little bit again about AFSP. We are a national organization, but we're built up of a series of chapters. So it's kind of the best of both worlds. We have that power and expertise of a national organization, but we're doing things locally on the local level in South Dakota. So I work with people across the state of South Dakota to bring in programming, to recruit volunteers, to really bring in AFSP information to your area. So again, I want to thank you so much for jumping on today, but I also want to encourage you, again, AFSP South Dakota chapter is a statewide chapter. So we have volunteers in South Dakota ready to provide programming. So I encourage you, again, check out afsp.org/South Dakota. Follow our local chapter on Instagram and Facebook and learn about some of these local things that we're doing in the area. Of course, thanks to the supporters of the Out of the Darkness events, there's no cost for programs like More Than SAD or It's Real. These are all programs that we want to bring to your communities. A lot of our prevention education programs focus around learning or educating about the warning signs, risk factors of suicide, and then how we can have strong conversations about our mental health and how we can reach out. So there's a number of programs that we can bring to your school, but also to businesses, to churches, to your parents at your districts as well. So I encourage you, there's tons of great information there. Please reach out to the chapter. I can help getting you connected to some of those complementary programs. As well as, of course, we talked a little bit about advocacy and our advocacy efforts. So thank you so much for sharing that information. But I also wanted to note we have a lot of information regarding resources for lost survivors. If you've lost a loved one to suicide, you know that it's a very unique type of grief. And it's very important that people know that there are resources here in South Dakota. So you can go to afsp.org/surviving suicide loss and get connected to resources, as well as our local South Dakota chapter will be hosting multiple Survivor Day resources or events in South Dakota. So Survivor Day is always the Saturday before Thanksgiving, and it's truly like a healing conference for suicide loss survivors so that you can come heal and connect in ways that you can in other platforms. So I encourage you to check that out, as well as, again, that's a complimentary event as well. So I encourage you, afsp.org/South Dakota. There's tons of resources that we can provide to your schools. And again, thanks to the Out of the Darkness events, many of these programs are absolutely free. We just need to get them to to your campus. So please reach out with any questions. And I know that I could keep talking about AFSP for a very long time, but we need to go on to Q&A. So on just behalf of South Dakota, thank you so much for logging on, as well as thank you for Andrea and her team for making this possible and setting this up for South Dakota. So I'll stop talking and we'll go on to Q&A.
Great.
Look like we have any questions up yet, but Doreen, was there anything that came up in our morning session that you might want to address while we're waiting to see if we get questions?
Yeah, so one of the things that was asked in the previous session was around kind of resources for non-English speaking parents and students. And I did mention on the previous webinar that this is something that, you know, as we've been thinking about how to reach more people with suicide prevention messaging, and also with a focus on diversity and inclusion, we have kind of leaned into translating more of our work, including some of our education programs and films. And I really think it's important, really in those instances, to make sure that if you have non-English speaking parents, that we've translated a number of things in Spanish, and our Survivor Day films have multiple translations. So again, you know, I do think it's important to reach, if you have a school district where many of the parents, English is not their first language, to look to some of the resources we have to help share suicide prevention information. I imagine that will continue. We will continue to develop those resources, since we recently signed an agreement with the National Latino Behavioral Health Association, and plan to work on kind of making more of those resources available. I'm trying to think. I think there was also a couple of questions around just logistics, and I know Taylor already answered some. If you need a copy of the Word document template, Sam, our South Dakota area director, can provide that. At AFSP, our emails are really simple. It's first initial, last name @afsp.org to get in touch with any of us on the webinar. And this is a recorded webinar, so a recording of it will also be made available. And like I said earlier, we'll make sure the PowerPoint, a document that's a PDF of the PowerPoint, is available to everyone as well. Other questions?
Yeah, there was one that came up about Native students. So Doreen, I don't know if you want to touch on that, or Sam from working in the Dakotas, if you have any comments on that.
Well, I'll start actually, Sam. That this is an area again where we are actively looking for partners to extend our reach and resources for Native students. You know, I do think our programs, you know, while we have many of them translated in language, there's also a cultural translation piece. And, you know, I can tell you we're actively for ways to get suicide prevention messaging in a culturally informed way to not only Native Americans, but others. So I would say, we did talk about this on the previous webinar, the best way to learn about what we're doing at AFSP is to sign up for one of our email lists. You can get the chapter newsletter emails, or follow our national and chapters on social media. We do a lot of Facebook Lives and different education events, panels from different organizations, and it's a way for us to try and more resources out there, not only those that are culturally sensitive, but resources that will just help your school district manage suicide efforts better, because these questions come up for us all the time, and we're actively looking for ways to make sure we can get as many resources in your hands as possible. I see a question, I think this is for you, Taylor. The state law, if a school district requires a student to be seen by a mental health professional before being admitted. Okay, I think someone is asking if the school district to pay for mental health evaluation services.
That's nothing I've ever heard of before, working in policy and advocacy. I would certainly be happy to look more into that kind of thing if you want to send me an email, but I've never heard of a law requiring that the school district pay for it. And in
Yeah,
fact, I don't know that they
I
can
will say
necessarily
this, we did,
require it. I'm not sure, Doreen.
yeah, no, I don't think it's the state law requires it, though I appreciate you taking a look. But we did address this in the policy document in the commentary section, because we were made aware that that is, depending on where you are, that that could be a requirement. But I'm not. I think what Taylor is saying is that you're not aware of a South Dakota law with that requirement.
Or that someone that they'd be required to pay for it. Not that I'm aware of, but I could certainly do some digging. That's just not an area we've necessarily worked on.
Yeah, it is. We do address this in the document itself, because we were made aware that this is a consideration. You know, I do think, so actually, if you look at the policy document itself, it's on page 17 in the document. And really what we're saying is you check your state requirements, because in some states it is a requirement. And it also, we also mentioned some things in there about the Individuals with Disability and Education Act. And so I would just encourage you to take a look at that particular section, because the school district may have some other requirements also around documentation. And so that's important to take a look at. It's on 17 in the document itself, but it sounds like Taylor isn't aware of a state law. We'll certainly, if we learn differently,
Yeah,
we will.
and any questions you have about laws like that, I don't have everything offhand, but I'm happy to work with you to try to figure that out. So if you ever want to reach out to Sam, she knows she can email me anytime with questions about policy or advocacy or anything like that. We're happy to kind of work with you on that kind of thing.
Yeah, one of the things I will say, and now I'll just kind of note this section, it does say in the document, in the commentary, if a student with a documented disability is prevented from returning to school until cleared by a mental health professional, the school district is expected to file for an expedited hearing pursuant to the Individuals with Disability and Education Act, and that the parent is entitled to all due process rights available under IDEA. So, you know, again, this is really something, as you're building out your policy, to not only keep in mind the any requirements at the state level, but also to be mindful kind of mental health and it being seen in the frame of disabilities and falling under, you know, the Individuals with Disability and Education Act. So thanks for that question. It's an important one. Other questions? See if we missed any. I'll give folks another minute in case there's other questions that come up. I will say one other thing that does come up just in our conversations is where the line is when a parent refuses to take their child to a mental health professional, or that you get the sense that the parent is not following through with required treatment. And we did talk about this in the commentary in the document itself, that this may be an instance where you might need to ensure student safety with a referral to Child Protective Services. And I realize those aren't done easily, but what I would say is that, you know, we really take this as seriously as if a parent was refusing medical care for a physical injury or illness, and believe that, you know, in a life-threatening situation, which we believe suicide is a life-threatening situation for students. So, you know, we really, the importance is to not wait to go through, but also I think to impress upon parents the importance of treating these like medical emergencies. Okay, and someone made a comment that they would call the local police department or CPS in that instance. Okay, thank you, Linda, for that. Other questions that may come up? You know, the other thing I'll say just about our policy work and our policy document work is that we really see this as a comprehensive approach that involves supporting staff and providing education to staff, providing education to parents, and then when possible, incorporating mental health education into curriculum. So while it's not required, really a best practice would be for younger students incorporating social emotional learning, promoting help seeking, helping them identify adults who are helpers in the environment, as well as what to do if they become aware of a friend of theirs that is struggling, to older students who will receive more education on mental health disorders and mental health conditions, on suicide prevention. Our More Than Sad program focuses on 9th through 12th grade in terms of educating on depression, anxiety, and help seeking within a high school population. Okay, just checking for some other questions here. Taylor, Sam, anything you want to add while we have a few minutes?
I don't think so. When you talk, just what you were talking about before did make me think though, we've seen a lot of states pass legislation this year that's requiring the hotline number be printed on the back of ID cards or in student handbooks, the Suicide Prevention Lifeline. So those are other small things too that kind of address the stigma by making it, an open topic to talk about and make students feel more comfortable, is just putting those resources on student IDs or like I said, handbooks, things that students have access to on a regular basis. That was just something, I think we've had like 10 states get legislation on that this year. So it's kind of a new idea we're starting to see pop up around the country.
That's great. And for the person that was also asking about American Indian Alaskan Native youth, I would also point you to look to the ihs.gov/suicide prevention site. Again, as we have more information, we always put information out as soon as we can. Also, I know the Indian Health Service does have some information related to suicide prevention that might help inform your policy writing. We do have that link in the model policy document itself, but again, that's ihs.gov/suicide prevention. Okay. Sam, Taylor, any kind of last comments before we adjourn today?
I don't think so.
My only comment is, again, please check out the resources that we have available. Our local South Dakota chapter can provide training, resources, tools to your districts, primarily at no cost, as well as even like posters that have the warning signs, risk factors, the Suicide Prevention Lifeline. We can get those to your school at no cost. Just please reach out to the chapter. So those Out of the Darkness event dollars make that possible. So don't let cost stand in the way. We want to be able to provide more resources in South Dakota.
Great. In closing, I would just want to thank again the South Dakota Department of Education and our colleagues that helped bring this, make this webinar possible, and to thank all of you for attending. I know that it can be, your days are busy, and particularly now, schools are facing more challenges than ever. And so I appreciate the time and the commitment that you all have to suicide prevention and to having a school district policy. We are available for questions and things as they come up, but I'd certainly encourage you to download the policy document as well as our After a Suicide Toolkit for Schools, and to use the information both on our website and in these documents as you go forward and develop your district policy, and as you amend it and revise it going forward. We like these documents to be timely and for school staff to be educated on the processes that a school and the procedures a school has in responding to suicidal students. But really, we also know that this is an area where legislation and other things real time. So we are mindful that you may have your district policy and also need to revise it or to make certain provisions related to COVID or other things that are happening in the world. I will say just really quickly, we have done a number of different webinars and panels focused on both on diversity, equity, inclusion, but we also did one fairly recently on back to school with the National PTA and the American School Counselor Association. And those are recorded and available through our AFSP's website. So that's another resource for you as you're building your school resources for your staff. Thanks again, and we appreciate the opportunity. Thanks to my colleagues that joined us today, and certainly reach out to us with further questions or further needs you have. We'll make sure to share the recording and the a PDF of the slide deck of this presentation. Thanks, everyone.
Thank you.